There's something that nurses are doing, and it's very insidious, but it is destroying our health. That thing is lack of sunlight. You may be thinking that you get enough sunlight on your days off, but I'm going to promise you and say that you don't. If you are working 12-hour shifts in a hospital and you never leave the unit to see the sun, and you're trying to make up for it on your days off, which are probably going to be minimal because you're trying to catch up on errands and do things that are mostly indoors, you're not getting enough sun. So, this is what you need to do. You need to find a way during the course of your day to go out and see the sun. Literally. It's not always the easiest, especially if your days are really, really busy. But what you can do is you try to gamify this. Make it a point that at least start off with one time and then you move to 2 times a shift, that you go outside, you get off of your unit, you go outside and you take off your glasses and you look up at the sky. Whether it is overcast or whether it's sunny, it makes no difference. You need to go and see the sun. You need the UV rays on your skin. You need the signal that it is daylight. And that helps you with your sleep. It helps you balance your circadian rhythms. And you may be thinking, like, how the heck do I do that? I work on a busy unit. Hey, I do too. And I work on the 7th floor of my unit, the last floor of the hospital. So here's a tip. When you made sure that you've dotted your I's, crossed your T's to the best of your abilities, because things were always going to happen, right? And remember, nursing is 24/7. So you do what you need to do. You see a patient, and then you let somebody know, hey, I'm going to, I need to go get some fresh air. And then you walk off. You take the stairs or the elevator, however you get there, you get there. And you go outside, you take off your glasses if you wear glasses, and you look up at the sky. I'm not going to say you take out your contacts, but because that's just not, that's not always feasible. But even with contacts, just do your best, but look up at the sky. And at least you can get the UV rays on your skin. It needs that. You can clear your head, be still with yourself to calm down, and maybe even, meditate a little bit while you're out there. And it does a lot of good. So make it a point. Try to start to go outside. You need the UV rays. You need vitamin D production to keep healthy. All right? So progress over perfection. Even if you do this if you have 3 shifts that week, you do it 1 time, 2 times, hey, you've made progress. And just continue from there. You'll be all the better for it. So if you need help with doing this, and for more tips like these, feel free to continue to watch my channel. Make sure you subscribe. And if you click on the link, I made a checklist. It's called the Heart Self-Care Checklist. And in there you will find some very useful interventions and tips to keep healthy. And you may even lose some weight if that's your aim. All right. Take care. Bye.